Good afternoon, everyone, and welcome to the Excel Your Well webinar series brought to you by Excellus BlueCross BlueShield. I want to start out by thanking each of you for taking the time out of your day to join us here today for our February webinar on the topic of the silent threat, how to recognize and prevent heart disease. My name is Katie Keller-Burgess, and I am part of the well-being team here at Excellus BlueCross BlueShield. So I will be the host for today's webinar, teeing up our guest speaker and health plan expert on this topic, Pam Rowlands, who I'll introduce here in just a minute. Now, the purpose of this monthly webinar series is to help educate and engage our members and really our communities on various health topics that aim to support your well-being. Now, I'm sure that many of you are aware that February is actually National Heart Health Month. So really the perfect time and opportunity to focus in on this topic. Now, research shows that heart disease remains a leading cause of death for both men and women, but it's also one of the most preventable. So today, our workshop will provide insights into what heart disease is, certain cardiovascular risk factors, common conditions and treatments, and lifestyle tips for how to improve overall heart health. And that's exactly what we'll be covering here today, because we believe that when our members have the information and tools they need to support their everyday well-being, everybody benefits. Now, just a few housekeeping items to start us off with here today. Please note that today's webinar and all of our monthly well-being webinars are being recorded and housed on our Excellus BlueCross BlueShield YouTube page. Thank you to my colleague Kate, who just put in the chat the direct link to that YouTube page. So if you need to go back and access this webinar recording or maybe a previous topic, once again, you have on-demand access directly through that YouTube page. Second housekeeping item I want to cover is that all participants' microphones and cameras are automatically disabled. Now, there will be time at the end of the webinar for questions that you may have. So we do encourage you, if you do have any questions at any point throughout today's webinar, please enter them into the chat feature. So at the top of your team's webinar, you should see a chat icon. And once again, enter them there and you'll get to those questions at the end. And lastly, it is important to note that the content covered here today is meant to be educational in purpose. Of course, if you have any personal health-related question or concern, we do recommend that you connect with your primary care provider. Or if you have any benefit or coverage-related question or concern, we recommend that you call the customer care number that's located on the back of your Excellus BlueCross BlueShield member ID card. So with that out of the way, let's learn a little bit about today's speaker, Pam Rowlands. Pam has an associate's degree in nursing from St. Elizabeth's College of Nursing, as well as a bachelor's degree in business administration, and is currently pursuing her MBA in healthcare leadership. Now, she has been a practicing nurse for over 14 years and began her career as an emergency room nurse in Syracuse, New York. Since then, Pam started her career here at the health plan in 2022 in case management as a physical health case manager. She has lived in the central New York region her entire life and currently resides in Cazenovia with her husband, 2 daughters, and son. And in her free time, she enjoys traveling, reading, and of course is a big fan of the Buffalo Bills. So Pam, we are so excited to have you here with us today to talk about this important topic. With that being said, I will turn the stage over to you.
Thank you, Katie. Just a big shout out to everyone that joined here today to learn about their heart health. To start off, I want to go over our agenda. First, we're going to do some definitions, some kind of common heart disease terms, some different risk factors, heart attack warnings, some tips to improve your heart health. And then we're also going to turn it back over to Katie at the end, who's going to talk about some additional benefits and resources offered. So first up, just some brief explanation of common terms that are used when we're talking about the heart. The heart obviously is a strong muscular organ that pumps blood throughout your body. One other thing we're going to talk about is your heart rate, which some people also call your pulse. And this is the number of beats per minute that your heart pumps blood. Heart health. This is the overall well-being of your heart. Heart healthy living involves understanding your risk factors, making healthy choices, taking steps to reduce your chances of heart disease. And then on to heart disease. This is kind of a catch-all phrase for a variety of conditions that affect the heart and the structures and function of the heart. And then even further down that is cardiovascular disease. And this is the term for all types of diseases that affect the heart and the blood vessels. So first up, I want to talk about a variety of the different tests and things that a specialist, which is called a cardiologist, would be performing to diagnose heart disease. First up, is just your kind of general physical exam. The doctor's going to bring you in. They're going to gather information about your own history, as well as any familial history, things that run in your family, any types of symptoms that you've been having, any medications you take. Also taking note of, the biological family members and what kinds of history they have. Some of the different tests that they might order, your basic lab tests, but this would also include cholesterol levels, electrolytes, a chest x-ray. It's a very quick test just to kind of get a picture. It's very low dose radiation, just kind of gives them a nice little visualization of your heart and the structure of your heart, if anything's abnormal, so we can have a baseline for you. Beyond that x-ray, if they want a more detailed picture of your blood vessels in your coronary arteries, they could order a CT scan, which is not invasive, but it is some radiation. There's also the availability of an MRI, which is radiation-free. MRIs use magnets, and it helps kind of give a very detailed picture of the different structures of your heart. Many people know what an EKG is, and it's that one where they kind of put all those stickers across your chest, and it gives them just a quick, 10-second picture of the electrical activity of your heart. This is generally something, if you're complaining of chest pain, it's kind of one of those first line tests to show if there's something immediately going on that could detect a heart attack or any irregular rhythms that could be going on. A Holter monitor, similar to that EKG, but it's something that the cardiologist is going to give you to wear over time. Sometimes it's a week, sometimes it's 3 weeks, depending on what symptoms you're having. But it gives them the availability, maybe that irregular heartbeat isn't going on right when you have that EKG, but it's happening throughout the day at certain times, you're having certain symptoms. It just gives them a longer picture of what your heart's doing over time. There's also the echocardiogram, which is the ultrasound picture of your heart. This kind of checks more of the different structures of your heart and the valves and the efficiency of the flow and how it's pushing blood through your heart. There's also an exercise stress test, and this measures the heart rate while you're working on a treadmill. Gives them a better picture what your heart's doing when it's exerted. A lot of times you're not picking up any issues until that heart is kind of pumping a little bit harder. And if you're unable to do the treadmill test, they do have medication that they can give you to mimic your blood or your heart while you're exercising on a treadmill. And that's called a nuclear stress test. I don't know if anyone's ever heard that before. And then once you kind of get past all that testing and they want to see a better picture, we could even go into what's called a cardiac catheterization or an angiogram. The picture on the bottom right is kind of what that's about, in a picture of your vessel where they go in with a little camera. It's usually through your wrist or through your femoral artery. And the goal is to kind of look deeper into any blockages. Checking your blood pressure during that test is ongoing. They want to see if there's any plaque buildups, and they're going to insert a balloon and maybe a stent to kind of open those different arteries back up for you. Understanding your risk for heart disease. I want to talk about some of the common risk factors that can contribute to the development of heart disease. Various health conditions, along with your lifestyle, can increase your risk. There's two types of risk. You have your modifiable and then your non-modifiable. Your modifiable factors are things that you can control. These are things like exercise, quitting smoking, having a better diet. Things that you can't modify are things like your family history, your genetics, your race, your ethnicity. And then we'll talk about also things that can affect your heart, like high blood pressure, high cholesterol, diabetes. Um, so it's very important to stay connected with your primary care physician so that they're continually monitoring all of these risk factors. Because right now, you might only have one and you're able to control it with your diet. But over time, things change, and it's best to have a baseline with your primary care physician. Talk a little bit about your blood pressure and what it really is before getting into how it connects to heart disease. So your blood pressure is one vital sign. And I know most people have heard, it should be 120 over 80 is your ideal blood pressure. And what that means is your top number is your systolic number. That's the pressure of blood when it's being pumped out of the heart and through your body through those vessels. So that number is always higher than the bottom number, which is your diastolic. And this is kind of like when your artery is at rest. Your heart is filling back up with blood and getting ready to push it out through. So your systolic should be 120, your diastolic should be 80. Hypertension. So we're connecting blood pressure to your risk for heart disease, and we want to dive in a little bit deeper. So with hypertension, it's a chronic issue of your blood pressure being high. And over time, this causes a lot of damage to your blood vessel, which, worsens if you're not treating it. And this condition can lead to a higher risk of heart disease, a higher risk of stroke. It can also damage your kidneys. Um, Hypertension is often called the silent killer because many times people don't have any symptoms until it's become so serious that they have symptoms. Or they haven't gone to the doctor in 10 or 15 years. And, at 28, you may not have had it, but at 38, over time, that has crept up. And now you're at a position where only medication is maybe going to work. And, the modifiable factors of weight loss and quitting smoking might not have the same effect. So with your modifiable factors, eating a healthier diet, getting rid of extra salts, unhealthy fats, increasing your physical activity. The biggest risk factor for many people is quitting smoking. And, losing 10 or 15 pounds can do great things for helping reduce this risk factor. Hypertension is generally diagnosed by tracking and recording blood pressure readings regularly. A lot of times your blood pressure could be a little bit higher when you go to the doctor, and that's something that we call, the white coat syndrome. A lot of times the physician, if you're kind of borderline, is not going to put you on medication because of one reading in the office. They're going to want you to keep checking this at home with your own blood pressure monitor, something that you can easily do every morning before you kind of get up and doing your thing for the day. Hypertensive emergency. This is when the blood pressure is dangerously high. For example, I had a patient that had a severe headache. They were having nosebleeds, checked their blood pressure, and it's 210 over 130. This is an emergency. Not only is their blood pressure high, but they're symptomatic. The headaches and the nosebleed is something that needs to be treated, something you would be calling 911 for. Now, if you're at home, you check your blood pressure one time, seems like it's high, wait 1 minute, retake that blood pressure. If you're not having any other symptoms, it is something you can call your physician about and explain to them, I was just doing my regular check and my blood pressure is really high this time. See what they want you to do. Now, if you're checking it and you're already experiencing chest pain, you're already having the shortness of breath, you're feeling very dizzy, having any other difficulties, that's something you want to call 911 for and get immediate help. Some treatments for hypertension: increasing your physical activity, quitting smoking again, reducing your alcohol intake, reducing unhealthy fats. There are medications that can be prescribed. These are things like ACE inhibitors, calcium channel blockers, diuretics. It's important to regularly check your blood pressure at home while you're on these medications, though, to make sure that they're working the way the doctor wants you to be having results. And when you're not, that's something that you need to follow up with them regularly. So it's not something where you prescribe the medication, one and done. You're like, okay, I'm fixed. Everyone responds differently to different medications. Here's just a quick visual from the American Heart Association website. And it's just a kind of an easy way to remember how to check your blood pressure. When you're prescribed medications, you always want to take those 30 minutes before you're checking your blood pressure. It's kind of the whole point. We're making sure that that medication is working. If you're not on medication, it's best to take it, in the morning when you're kind of the most relaxed before your day starts. You want to be sitting for at least 5 minutes. You want to be in a chair, upright, legs uncrossed. You've emptied your bladder at this point. If it is high, you want to wait 1 minute and then you can take it again. Keep recording these on a daily basis because this is something that your doctor is going to want to see, especially if you're having abnormal readings. Up next is hyperlipidemia, which most people call high cholesterol. Um, and more cholesterol when you eat more cholesterol through food than your body can use for energy, it can build up in the walls of your arteries. And this builds up and decreases that blood flow to your heart, your brain, your kidneys. Basically, every organ in your body is going to get kind of gunked up if your cholesterol is high. So this is where the lipid panel comes in that your physician would order. And this measures all different levels of cholesterol. And this can be your HDL, your LDL, and your triglycerides. Your cholesterol is in what's called these little packages they're called lipoproteins, and they carry your cholesterol around in your body. And you have your high density, which is when I think of these, I think of HDL as your healthy cholesterol. That's your good cholesterol. It gets rid of all the yucky stuff that's in your arteries for you. Whereas the LDL, which I call lousy cholesterol, that's the one that's that's the one that builds up over time and contributes to heart disease. So ideally, your healthy cholesterol, your happy, healthy, should be in men 40 to 80, women 50 to 80. And then your LDL is that number that should be under 100. And those are kind of like the numbers where if they start to creep up over those, that's when the doctor's going to start talking about medication. Your triglycerides, they build up in your body, no good. They harden your arteries. They cause a lot of inflammation in your pancreas. They can lead to stroke. They can lead to liver failure. Those are the ideal number is nothing over 150. You start getting into that 200 range, that's when, your doctor's going to start talking about medication for you. Treatments for high cholesterol: heart healthy diet. I know we keep repeating that, and diet plays such a role in any heart disease, honestly. Exercise. And exercise, it doesn't mean this hardcore getting on a treadmill, running every day. It could just be some weights, taking a walk after dinner. Not only does it promote a healthier lifestyle, it promotes your digestion. It, can kind of just overall help you feel better. Smoking cessation, huge. Smoking is a huge factor with any heart disease, any disease, honestly. Um, so and then medications. This is where your statins come in, your torvastatin, simvastatin. Um, and then there's also a newer medication out on there on the front, Repatha, which is an injectable. These are all things that you can talk to your doctor about. Lowering your cholesterol really helps reduce risk of heart disease and stroke. And the statins and the Repatha help to block a specific enzyme that's a key factor in cholesterol production and can reduce all your risk factors. Just a quick little blurb on one of the most important modifiable risk factors, smoking cessation. Nicotine, cigarettes, e-cigarettes, they all cause permanent damage to vessels. So even other modes of tobacco, people use chew, or the new thing is those Zyn packets. They're just put you at a strong risk for detrimental health conditions. So quitting as soon as possible is the best. 20 minutes after quitting, your heart rate drops. 12 hours, your carbon monoxide level drops. And within 4 years of completely quitting smoking, your risk of stroke drops to that of a lifetime non-smoker. There are nicotine replacement therapies that can help you as well with the nicotine cravings. There's things that your doctors can prescribe to you. There's the New York State Quit Line. You have case managers here at Excellus that can help with these types of things as well. The last risk factor contributed to heart disease is, believe it or not, type 2 diabetes. Normal blood sugars increase after each meal. And with that comes insulin that's released by your pancreas. Insulin causes the body to absorb sugar from your blood, which lowers that blood sugar. But when you have type 2 diabetes, your body can't use that insulin in the right way. So your sugar stays high in your bloodstream, and it can't enter the cells and be used for energy. And this leads to that high reading. Type 2 diabetes puts you at an increased risk for declining blood vessel health, which contributes to heart disease. Anyone with type 2 diabetes obviously has a higher risk, but men are at twice the risk of developing heart disease if you have diabetes. Women are 4 times the risk of developing heart disease if they have type 2 diabetes. Some of the symptoms that come with type 2 diabetes: feeling more thirsty than usual, more hungry than usual. You are urinating more often. You're losing weight. You're not even trying to lose weight, but all of a sudden you start losing and you're not sure why. Having blurry vision. Your doctor can order tests to kind of check for this. And this is another reason to kind of have that annual visit with your primary care physician to establish a baseline. One of the tests, it's a fasting test, which can check your blood sugar in the morning. You've fasted for the past 12 hours, kind of see where you're at. Then there's also this test called the A1C, which is an average amount of the blood glucose over the past 3 months. And this is measured in a percentage. So it gives them just a bigger picture. Maybe today you weren't feeling well, so your blood pressure, your blood sugar was a little high or a little low. But with this A1C, we can really see over the past few months what's going on. And it's best to have a baseline. So if that starts to creep up even just a little bit, being aware of that and making small changes can really prevent that from progressing. Small dietary changes can really affect that A1C and any complications from heart disease. So how do you know if you have diabetes? Your doctor will do a physical exam, ask you what kind of symptoms you might be experiencing. Again, those blood tests. You see the little pictures of the blood vessels and what they look like when more sugar is in your blood. That extra sugar is what damages the blood vessels and can lead to heart disease. So your normal fasting blood glucose, when checked, should be less than 100. A pre-diabetes reading would be 100 to 126, and anything over 126 is considered diabetic at that point. Um, it's very prevalent in our society right now, and a lot of it has to do with diet and obesity. Now that we know some of the risk factors, let's review a few of the most common conditions under that umbrella term of heart disease. So first up, we have coronary artery disease, CAD. It's the most common type. There's a visual here on the right-hand side. Fatty deposits called plaque build up inside the coronary artery, and this kind of reduces that blood supply to your heart. The process of plaque buildup is called hardening of the arteries or atherosclerosis. Plaque buildup may reduce blood flow to the heart muscle. Like any muscle, the heart needs blood to work well. And if the plaque breaks apart, that's when we worry about heart attacks. It can lead to things like cardiomyopathy, which is an enlarged heart, can lead to heart failure, and just all sorts of serious issues. Again, risk factors. We've talked kind of about quite a few of these. Hypertension, high cholesterol. Modifiable is your smoking. You have your type 2 diabetes, obesity, a lack of physical activity, and a poor diet. And you still have your non-modifiable things. Some people are just have a predisposition to having any of these risk factors as well as heart disease. Signs and symptoms and treatments of coronary artery disease. The biggest one is chest pain, with or without exertion, just that sudden tightness and pressure. You can also experience that in other parts of your body as well. Any shortness of breath, inability to kind of catch your breath and get your heart rate to slow down. Unexplained tiredness and fatigue are a big one. Very, you could think, oh, I'm just getting older and I just feel more tired. But if that's a sudden change for you, that's something you want to bring up to your doctor. Don't kind of push it aside as, I just don't feel good, or, oh, it's wintertime, everybody feels more tired. Now, if it's different for you, it's something, and if you have any other of those factors kind of going on, it's something you should be bringing up to your doctor. Again, treatments, healthier diet, lowering your fat intake, lowering your salt intake, limiting sugars, alcohol, quitting smoking. Managing your stress is a big one. I know a lot of people, talk about they just feel crappier when but it actually has physical implications to your body as well. High stress does. It's not just emotions. Again, there's medications that can help with managing that plaque buildup, like the cholesterol medications and things like that. There are invasive treatments, and this is where we get more into once they've found that blockage going on in your heart, and you have your coronary angioplasty, which is where they kind of go in and, I want to say, funny term, roto-root your heart, get out some of those blockages, put in that balloon and that stent that kind of opens everything back up. If you're kind of more damaged and beyond the ability for them to go in and do that, there's things called bypass surgery. I don't know if anybody's ever heard of CABG, but this is where they have to take a vessel from a different part of your body to fix a blocked vessel in your heart. So they create a whole new pathway for that blood to go around, and that's why they call it the bypass surgery. So that blocked or narrowed coronary artery has to be completely replaced. That's pretty invasive, and we try not to get to that stage, but there is treatment. Next up, heart failure. This is called congestive heart failure, or CHF, and this is defined as your heart having damage and it's weakened functioning to the point where you can't pump the blood through the body, and this needs immediate attention. Your body does try to make up for this weakness, and what it'll do is hold on to salt and water, which can kind of increase your blood volume. It thinks that you need more blood to be able to get it to all of the different parts of your body, and this causes your heart to enlarge, which is that little picture of a normal heart and heart failure. So it really decreases that muscle part of your body so that it's not pumping as efficiently as it should be. Your retained fluid eventually builds up in other parts of the body, which leads to that congestive feeling. Risk factors of developing this are dietary habits and eating foods that are high in salt and fat. And this is a leading cause of hospitalization in people over 65. So it is something that if you're not keeping close track of as you age, it can kind of sneak up on you and really do some serious damage. Whereas if, your doctor knows about this and starts seeing the early warning signs, we can really take some preventative action. CHF symptoms, diagnosis, and treatment. With a lot of the heart disease, you're getting more tired, you're weak, you're lightheaded, you're short of breath. But specifically with this type of heart disease, you get that swelling in your extremities. Especially if you have something where you're on your feet more, you're going to start to notice that your ankles and your feet swell up. If your hands are dangling more, you're walking and things, and you start to notice that stuff is swelling more, those are signs of CHF. A physical exam by your cardiologist, as well as blood work and an echo, are ways to diagnose this. There are treatments for it. It generally cannot be reversed, but your echo is going to show what kind of ejection fraction you have, which is how good your heart is pumping that blood throughout your body. They can prescribe medications. Pacemakers can sometimes help. Daily weight tracking, that's a big one with your physician. Once they've started you on some medications, they want to make sure they're working. If you're, gaining more than 2 or 3 pounds in a day, that's an alarm and something that may need some more attention. Reducing your sodium intake, whole grain foods, managing your fluid intake. You'll probably be on a fluid restriction for the most part. Common cardiac medications, just kind of quickly, if you've seen these before or not, but some of them are familiar to people, like valsartan and atenolol are angiotensin 2 receptor blockers. We have beta blockers. Pretty common one is metoprolol. A lot of people are on that for blood pressure, heart rate issues. This can help with chest pain and angina, heart failure. You have your calcium channel blockers, which is your amlodipine. This kind of helps widen the blood vessel, which will lower your blood pressure, improves blood flow to the heart, and reduces chest pain. ACE inhibitors like lisinopril, it makes it easier for the heart to pump the blood throughout the body. It relaxes the vessels. And we can't talk about cardiac conditions and heart health without raising awareness of heart attacks. This is also called a myocardial infarction. It can be silent and not diagnosed until a person is experiencing signs and symptoms of a heart attack. It's important to recognize your own personal risk factors as well as the signs and symptoms of a heart attack. And they are different for men and women. In men tend to get that very sharp, crushing chest pain that, you see in movies and things like that. It's not always that obvious in women. It's more of a discomfort, a pressure, a fullness in their chest. Men and women can both experience that jaw pain that's going down your left arm, indigestion in your stomach. If it's something, indigestion might hit you after you eat a meal. But if indigestion is hitting you all the time and it's bothersome and it's waking you up at night and the medications that you're normally taking are not working, those are things that you want to bring up to your doctor. It should be checked, especially if you have other risk factors. Shortness of breath with or without chest pain. A lot of times people aren't experiencing that chest pain until they go out to mow the lawn and all of a sudden they're sweating profusely. They're, bent over. They can't catch their breath quite as easy. So just some different things to take a look at. Women tend to kind of push these symptoms aside. So it's just know that if something's different for you, you should be checking with your physician. We're going to wrap up talking about heart health with suggested methods to avoid heart disease through prevention and early detection. Importance of preventative care. Obviously, routine physical exams, early detection can save lives, keeps you healthy inside and out. Preventative screenings cover concerns you can see as well as those you can't, like high blood pressure and high cholesterol. Allows you to take control of your health. The more you know about your body, the more you're going to take care of it. We're in February, which is Heart Health Month, meaning there's an entire month dedicated to the knowledge and awareness. Gives us a chance to take control of our health, really kind of take advantage of all the different avenues here. Reduce your risk. The American Heart Association recommends 150 minutes of moderate to intense exercise every week. If you're able, this can even look like, you're standing in the kitchen cooking dinner. You're just kind of waiting for things to finish up. Do some stretches, do a little walking in place, just kind of informal workouts at commercials. Get your walking pad out while you're watching your favorite show. 30 minutes flies by when you're watching an episode of Friends. Dietary changes don't have to be dramatic. You can eat, choose foods that have a little more vegetables in them. Instead of your white bread, go for your whole grain bread. Another measure is annual physical exams with your doctor. It's establishing your baseline and any potential risk factors that may be there. Avoiding extra strain on your heart, and this means managing your stress, getting good sleep. And we do have resources that Katie will go over in the next few slides that help members get connected with care managers to help manage smoking cessation. Thank you so much for having me. Hopefully you feel a little more informed, a little more confident about your own health, and kind of being able to talk to your doctor about your risk factors.
Perfect. Pam, thank you so much. That was so much great information that you were able to cover. I see a lot of great reactions, and hopefully, as you mentioned, everyone was able to at least take one thing away with you today to implement into your lifestyle and improve your well-being. So I'll jump into the related benefits. I do want to call out that the benefits I review do vary by contract. So if you have any coverage questions, please contact the customer care number on the back of your health insurance card. But first, starting off, I want to review our member care management team as well as some of the ways to engage with them. So, Excellus BlueCross BlueShield has a variety of healthcare professionals on our care management team, such as registered nurses like Pam, as well as registered dietitians, behavioral health specialists, respiratory therapists, and more, that are all here to support our members whenever you need us at no added cost. So they can help with a variety of conditions and or concerns, such as the things Pan mentioned around diabetes, high blood pressure, cholesterol, movement, physical activity, stress management, smoking cessation, a key component that Pam kept mentioning. If interested in quitting, a great program available through there. So once again, you can connect with our care management team for free. There are multiple ways to engage with them, whether it be through phone, email, whatever your personal preference is. But there is also an additional way to engage with them through the WellFrame app. So WellFrame is a free app our members are able to download and create your WellFrame account. And through the WellFrame app, there's a variety of tools, programs, and resources that our care managers can be helping to provide to you to provide that guidance and personalized care plan regarding whatever you may be looking for additional support for. So if you download that WellFrame app from either Apple App or Google Play Store, we'll ask you to create that WellFrame account, and you will need your subscriber ID from your health insurance card as well as an access code, and that is, as you see on the screen here, Excellus Welcome, all one word, all lowercase. There is an embedded chat feature in WellFrame, which on the other end of that chat is our care managers and that team to really help provide that personalized support and care for you, whether it be for little, questions relative to your eating habits or maybe all the way up to big health challenges and comorbidities you may be experiencing. So a great team to be aware of, take advantage of if interested. Another great program Potentially available is Blue 365. This is an online deal and discount program that allows eligible members access to a variety of deals on health and wellness related products and services. A very popular deal is a Passport Gym membership programs available through Blue 365, as well as deals around nutrition. You can see some of the great programs available through there, as well as other health topics such as hearing, vision, travel, and more. So a lot of members are not aware of Blue 365 and is a great resource to help take advantage of some added deals and perks for simply being an Excellus member. And then the last benefit I want to review here is Thrive Well through our partnership with Personify Health, one of the leading vendors in the well-being space. So Thrive Well is a digital home base for our members to help support their health and well-being. Through Thrive Well, there's a variety of tools and resources such as challenges, daily journeys to really help stay on top of those healthy habits, whether it be trying to increase your physical activity, trying to eat healthier, maybe trying to better manage those stress levels, aren't we all? There's also a health risk assessment, a little health check available through Thrive Well that really identifies those areas of opportunity based on your current behaviors and once again provides you some practical methods to engage within it to help support your overall well-being. So another great program to access if available to help support your well-being. All right, now before we move on to questions, I do want to give a quick plug for our upcoming March webinar on the topic of food as medicine. Nourish your body, transform your health. I think Pam really spoke to the fact and how important what we are consuming through our diet, whether it be what we're eating, what we're drinking, can really play an overall impact on our well-being. So the March webinar will be with Katherine Townsend, one of our registered dietitians, part of that care management team. And she's going to be focusing in on some anti-inflammatory foods that we can be eating, as well as practical tips for helping to support your eating habits. So that will be Thursday, March 26th at noon. If you have your smart device out and want to scan that, or once again, my colleague Kate just put in the chat the direct link to register for that upcoming webinar as well. So with that being said, we want to use the remaining time for any questions. As mentioned, if you do have a question, please feel free to enter it into the chat feature. There is one that has already come through, Pam, so I'll read that one off. Is a lipoprotein a common or uncommon test in evaluating your blood levels in relation to heart health? Any thoughts there, Pam?
Yeah, it's very common and something that the doctor will order. It's your cholesterol panel. So it's your HDL, your LDL, and your triglycerides will be measured.
Wonderful. Thank you. Let's see here. Another question that came through. How frequently should someone be getting their blood pressure checked? They prioritize physical activity and eating healthy, but really not great at maybe knowing their numbers, which is a popular phrase. But how often and frequently should you be checking your blood pressure, would you say?
I would say if you have no other risk factors and you haven't noticed it creeping up at all or any symptoms, once a year at your primary care physician annual exam is fine. If you're getting a little bit older, 40s, 50s, it's something you would want to check at home probably once a quarter just to make sure it's not creeping up at all on you.
Awesome. Another question around sharing of the slideshow. I will say that these are recorded and will be housed on our Excellus BlueCross BlueShield YouTube page within about 2 weeks from the live one. So you can always access and be able to listen to all the great information that Pam shared here today. Another question that I personally had, Pam, is around the automatic blood pressure measure equipment versus kind of the manual with the stethoscope, the blood pressure cuff maybe getting done. Is one
Mhm.
or the other better? Is there differences in numbers? Can potentially people see a number at home when they're doing it on their own and then go into their doctors and it may be completely different? What are your thoughts there?
Yeah. So at home ones are great to keep kind of a monitor on them. If you're noticing when you're taking your blood pressure at home, it's very different from the one of your physician in the office where they're taking it with the stethoscope and everything. They'll do what's called a calibration for you. You can bring that monitor into the office when you have your blood pressure checked. It doesn't even have to be a doctor visit. A nurse or one of the LPNs in the office can do that quickly for you just to see how different it is. And if they do notice, there's a huge discrepancy, then your blood pressure cuff is probably old or malfunctioning, maybe needs new batteries, but they should be generally just as reliable as the in-office.
Awesome. Thank you. And then last question here, just based on time. What is a good source to find out what foods are low cholesterol? I will jump in quickly and mention that care management team that I referenced
Yeah.
earlier includes a variety of registered dietitians. So they are really the go-to subject matter experts. And if you want to connect with them, once again, for free to really help, iron out your eating habits and maybe identify those low cholesterol types of foods. They are a great resource. But any other thoughts there, Pam?
I was just going to mention WellFrame also is a great resource, our wellness app. Um, and then just a quick Google search of a DASH diet is a wonderful resource. And there's so many ideas and so many resources for recipes and things like that.
Awesome. Well, once again, thank you, Pam. I do want to call out in the chat, my colleague Kate did put a feedback survey. So anyone who attended here today, we please welcome you to take that 2-minute survey and give your feedback on today's webinar, as well as future topics that you're interested in hearing about, as we really want to make these meaningful for our members. So with that being said, thank you again all for joining us here today. Thank you, Pam, for the great information, being so knowledgeable and passionate. And we hope to see everyone back here in March for that webinar on the topic of nutrition, really using it as food as medicine. So thank you again. I hope everyone has a wonderful rest of your day.
Thank you.
Bye, everyone.